Good afternoon. Today's Friday, September 25th, 2020. I'm Terry Scoggin, CEO of Titus Regional Medical Center in Mount Pleasant, Texas, and this is our weekly Titus Community Health Update. As we've talked over the last few weeks, as we move through COVID and the pandemic and the crisis together as the Northeast Texas region, we're going to change these updates up a little bit. As of today, we're going to start going every other Friday. The intent of them is give a community health update. Are there changes in COVID? Are there changes in the pandemic? What's going on with the health system? What's going on with the community? Just wanted to keep an open line of communication. The last 6 months, I've loved the ability to talk to you guys on a weekly basis and to spread what's going on, the good and the bad of the health system and the community. So as we approach today, the 25th, and there's a little bit of wind and cool air around the rain this week, that can only mean one thing. Football season is upon us. So I am not going to turn today's community health update into Terry Scoggin's Football Pigskin Classic, but I do want to congratulate the high school football team and all the athletes in the junior high and high school, the coaches, the administrators, especially the parents, for all the work that they've done over these last 6 to 8 weeks in preparation for tonight. I want to wish Coach Richie Pinkert and the rest of the staff of the Mount Pleasant High School best of luck on the season that starts today. And we want to wish our Tigers the best of luck as well. Hope everybody stays healthy. Hope everybody stays COVID-free. And we hope it's a great season. We appreciate what the coach and what the coaches and the parents and the team mean to our community. And we appreciate what the Mount Pleasant Tigers mean from a football perspective from our community as well. So good luck, guys. We're behind you, and Titus Regional supports you. And good luck to our friends Daryl Grubbs and Carrie, who'll be on the air tonight. So it's my shout out to my buddy. And so I expect a shout out from him as well as they become the voice of the Mount Pleasant Tigers tonight as they air across the radio in Northeast Texas. From a health perspective, we start talking about flu shots. Over the next few weeks, we'll see some things change. As of next Wednesday, GoGetTested.com will no longer be at the Civic Center. Titus Regional Medical Center is working closely on a solution for that, and we hope to make an announcement next week to help with that. But flu shots are here. I love the Band-Aid. I wish I had those from there. And then if you look at our Facebook, our marketing team's done a great job of showing different leaders in our health system with their flu shots. I definitely have some working out to do to compare myself to the other doctors who are showing their Band-Aids. But flu shots are important this season. Nobody knows the impact of COVID and flu. I've read a lot of studies. We have a lot of discussions. What is flu season going to look like within a pandemic and a crisis? And the answer is nobody knows. So I encourage everyone to wear a mask. I encourage everybody to social distance. And I encourage everybody to get their flu shot. I've had my flu shot. I've encouraged my health system to have their flu shots as well. So we'll have those available at all of our family care centers and at our community health fair on Saturday, October 10th. Tennyson does a great job on an annual basis of working with community members and Titus Regional Medical Center to put on this health fair on an annual basis. I've been privileged for the last 8 years to go to this health fair and serve in a variety of roles. I'm usually a gopher, working usually in the lab area or of running in what Leanne tells me to do. And it is amazing to watch what this church and what the community members do on this day. I want to thank our leaders at Titus Regional Medical Center and at Tennyson for not letting this pandemic stop the good work that happens at this health fair. On the 10th of October, we are going to do a community health fair. It's going to have a little NASCAR type theme. It's going to be a drive-through. And the lab, the primary care people, the marketing people have all set up some ways that we'll be able to accomplish the health fair as people remain in their cars, remain masked, get blood drawn, get flu shots. So encourage you to mark your calendars for Saturday, October 10th from 8 to 11. You'll see more coming from Titus. But just thank you to everybody who's involved in putting this on. A lot of work has been gone to make sure this community health fair continues and supports the members of this community. As far as COVID, the numbers, we're continuing to see an increase. The last 2 weeks I've averaged between 1 and 2 in the hospital with COVID. So we've seen those numbers go down. The exact opposite has been seen in our clinics. With the starting of school, we've seen a lot more testing. We've seen a little increase in the number of positives that we've seen over the few weeks prior, but the numbers in the hospital have maintained fairly low. This week we saw kind of the exact opposite. Fewer of the testing and positives coming through, but more people sick in the hospital. At one point this time we had 7 people in the hospital, 5 on the floor, 2 in ICU. This morning we had 3. 2 in the floor, 1 in ICU. So encourage you to watch, be careful as we continue to monitor these numbers. From a community perspective, we're about 2,300 cases right now. So we're still battling that one, and we're seeing that increase. I mentioned earlier Family Care Center, Harts Bluff. We're excited at what's going on over on that part of town. It's Dr. Reichert's old building. It's easy for people to find. It's a great clinic that we've added to our practice and to our community. Dr. Jay Cannon started a few weeks ago. Brad Burrows has been in this community his whole life. Talisha and Allison are 2 wonderful people that we're glad to have on our medical staff here and as a part of our primary care team. They're doing a great job at the Family Care Center, Harts Bluff. They're open. Please take a look at the number. Feel free to call and get an appointment. Had one of my counterparts today who got her annual physical today at the Family Care Center, Harts Bluff, and said it was just a great experience. We appreciate everything that's going on over there. So from a primary care perspective, the Family Care Center on the south side of town, the north side of town, and Dangerfield, we've got your primary care needs covered. Had a good week this week from several opportunities. The Texas Organization of Rural Community Hospitals is a big supporter of rural health care in Texas and in the United States. Do a lot of initiatives and advocacy for health care. We are a member. I serve on the board of directors. I also serve on the executive board representing the East Texas area. And we had our annual conference this year. And the conference was in Bastrop. Well, it was virtual. And for a few people from different areas who do not have much COVID in their areas came. From our perspective, it's critical we stay here and work side by side with everybody going on. I did have the opportunity to do 2 presentations this week. One did a presentation of COVID-19, of what it's meant for our community. We have changed not only this update, we have changed from the ability to present and do things. I did reference our weekly update and reference our community in my presentation. Had the opportunity to talk about COVID and what COVID has done for our community and how our communities responded. So it was a great opportunity for me to brag on our medical staff, to brag on our clinics, to brag on our health system, and to brag on the community leaders, and finally the community of Mount Pleasant. When you look at the numbers and what we went through during that time, and you see those types of numbers, 2 cases in March, 26 in April, 626, 611, and you look back and see how far we've come in the last 6 months, it's amazing. And we were able to share that story. Yesterday and last night, towards the end of it, I had the opportunity to participate in another part of the conference and introduce and moderate a discussion with Darren Roberts, a local hero, and is working in the Austin area at the University of Texas. He gave the keynote address to the Texas to Torch last night and talked about leadership, talked about COVID, and talked about the fundamentals of what things he learned growing up in Northeast Texas and how he's putting in place today and how leaders of healthcare systems can take those as well. It was pretty emotional. It was great to see our community be represented, not only from a Torch standpoint, from a state, and all the work he does. So, Darren, thank you for the work and thank you for the opportunity to share from there. Again, a couple more things that are going on. Just want to give final updates of the health system. We are excited to announce that Titus Orthopedics Clinic will be adding a new physician assistant in the next few weeks. Dr. Pappas joined us in January. Dr. David Hester has been here since 2017, and together they've put together a very nice, one of the best orthopedic practices in Northeast Texas. Jacob Green is the nurse practitioner helping them, and we've added a new physician assistant who will help access and create more opportunities for appointments in that clinic, allow them to work and do more surgeries and get you in quicker. So we're excited to announce that. We're also excited to announce some changes as we work through COVID, and you'll see changes every 2 weeks. We'll start announcing different things that are happening. Hopefully in the next few weeks we'll announce we'll open the pool again. Hopefully in the next few weeks we'll do this and visitation. We'll look at those things. We'll use this tool and this forum to do it. Calcium scores and heart attacks have been heart attacks been a big thing in this area for many times. Terminal cause of death in Northeast Texas, heart disease. Calcium scores were very critical to us to be successful. We have stopped those during COVID, but we are working to have those started in the next 2 to 3 weeks. Our goal is by the end of October, we'll have the calcium scores back up and running. So listen to this update on our Fridays, and we'll keep you updated on that. We will be moving those from the hospital to Imaging Plus and opening up some more spots. So it should be easier to come in and out. You won't have to go into the hospital to have those scores done. So we're excited to be doing more of the calcium scores and get those going in the next few weeks. from a Titus regional perspective, we're starting to end our fiscal year. So we appreciate everything that's happened over the last 6 months in support of this community. One final note, good luck to all the members tonight. I would encourage everybody who's going to the football games to remember the masking rules that apply. Your administrators at your high school, your coaches, the staff involved, they're not the ones who are setting the rules that we'll have to live by. So please be patient. Please be understanding when you're wearing your mask at the games, and just go out and have a good time and yell for our Mount Pleasant Tigers. You guys have a great week. God bless. See you in 2 weeks.